Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to deal with a very important subject on the program today. We're going to talk about the coronavirus, and joining me to chat about that is Dr. Rachel Levine. She is the Pennsylvania Secretary of Health, and Dr. Tirupathi, MD. He's the medical director at Keystone Infectious Diseases. And then we're going to have the president, if you will, of the Pennsylvania Healthcare Association, and we're going to find out what's going on in terms of dealing with the coronavirus at Pennsylvania's nursing homes. As they say, let's get to it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, sitting across from me is Dr. Tirupathi. As I indicated, he's the medical director at Keystone Infectious Diseases, and sitting next to him is Dr. Levine. She's the Pennsylvania Secretary of Health. I guess the big question is, how did the coronavirus, or COVID-19, I always just simply call it the coronavirus, how did it start? And it seems to be spreading now much more rapidly in our country.
Sure. So it's called coronavirus because of how it appears under an electron microscope. It looks like it has a crown. And coronaviruses is a family of viruses which are actually quite common. And coronaviruses can cause many colds. But there are some coronaviruses which seem to be transmitted from animals to people. And this seemed to start in a market in Wuhan, China, what's called a wet market, where they have many different rather exotic animals all kind of packed together, and they're actually live animals that are then butchered and used for meat. And it's not exactly clear which animal this came from. It might be a bat, but it's really a breeding ground for viruses and mutation of viruses, and it seemed to start there. This is the third coronavirus that we have seen in the last 20 years. The first was SARS. The second was called MERS, which was actually from the Middle East. And now we have COVID-19. It spread in China, and then from China has spread to much of the world, with really way more than 70 countries now involved with this epidemic.
Now, Doctor, one of the interesting things about it is how it seems to look like, to the casual observer, not to folks like you, like a normal case of the flu. And it also seems to affect by demographics certain people differently, like older folks, particularly older folks with some underlying health care. Young folks don't seem to be, if they get it, it's so mild. But you're the doctor. Help me out here.
So you're exactly right. So coronavirus is very difficult. Coronavirus infection is very difficult to be differentiated from a regular flu, and that's what makes it so challenging at these times. We are in the midst of one of the worst flu outbreaks in this country, and the season is for the flu season. And when you have patients coming in with a similar presentation, which is fever, body aches, cough, shortness of breath, it's difficult to differentiate sometimes with a coronavirus versus a flu infection. So definitely, I think that's very challenging, but travel history will help sort that out.
Look, one of the interesting questions that keeps coming up, and you hear a lot about it at the national level as well as in the state level, are so-called testing kits. And are you comfortable? And as we speak right now, there's no Pennsylvania case on record anyway. I'm not saying
there is no confirmed case of COVID-19 in Pennsylvania.
Okay. So are you comfortable with the availability of testing cases? Should we begin to, see the virus in our state, in terms of making sure that people can get tested properly and that the safeguards are there?
So previous to this week, all of the tests were done at the CDC, or the Center for Disease Control and Prevention in Atlanta. And now we have started to test in Pennsylvania. So starting Monday, several days ago, we started testing at our state laboratory in Exton, and we can do approximately 20 to 25 tests a day now, and we're getting a new piece of equipment in today or tomorrow, and by the weekend we'll be able to do 125 to 150 tests a day. The CDC did have difficulty over the last month on getting the tests out to states, and so the initial testing kits had a reagent which had difficulties, and then they tried to recreate that reagent and it still had difficulties, and so finally they came up with a procedure last Friday, sent out to the states over the weekend for testing. We validated that over the weekend and we started testing on Monday. So we are feeling much more comfortable now about our ability to do testing in Pennsylvania.
Yeah, same question to you, given what you do. You know, you're a medical director, you're right in the field. Take it. What have you done?
One of the biggest and the most pivotal points in controlling this epidemic is to have validated and accurate testing. I think CDC now has put up a multi-agency concerted effort to put out validated testing, where testing will now be available through the public health labs predominantly, but also through university hospitals. And there's something known as emergency utilization authorization.
Emergency utilization
authorization. So where the CDC allows private labs to develop their own tests, and that's also in discussion.
So, all right, we got to run to a break in my ear, but I want to let you respond. I also want to get to a big question about how Pennsylvanians can stay healthy, and we'll get to all of that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. Well, we're talking about one of the most important subjects, and we're trying to get a handle on what is going on in our state. What about coronavirus? What are the symptoms? And we're getting into some of the details. All right, Dr. Rachel Levine, she's the Pennsylvania Secretary of Health. Take it. You wanted to make a comment about previous...
Yes, the doctor is referring to testing that could be done at hospitals or health systems and also through commercial laboratories.
Right.
We expect that to be available in approximately 1 to 2 weeks, where even more widespread testing would be available to physicians to order.
All right, well, there's one big question out there. Well, no, there's about 100 questions, but how can I'm going to ask both of you. I'll start with, how can Pennsylvanians stay healthy?
Well, so the best way that individuals in Pennsylvania can stay healthy is to wash your hands. And so we want people to practice really in-depth hand washing, wash hand 10, 20 times a day.
I'm right there with you,
You're right
doctor.
there.
I'm right there with you. In fact, I have a little thing in my car, you know, antibacterial. I hit it and I do it a couple times.
That's the other thing. Now, we want people to do it with, warm water and soap, and to do it really for up to 2 minutes when you wash your hands. And when you can't wash your hands, to use the hand sanitizer that you were talking about. Try not to touch your face, especially after
you
touched...
mean like I'm doing right now?
Exactly. Because after you touch surfaces, if you touch your face, if the virus was present on surfaces, it could transmit it. Of course, if people sneeze or cough, to do it into your elbow. And please, if you're sick, stay home. There are also some travel advisories, and they're on our website and the CDC website, and people should pay attention to those because they do change almost every week.
I want to get into that area because that's particularly important, but take it.
So to add on to that, if you're using tissues, don't use handkerchiefs. Use disposable tissues.
And make sure you dispose them properly.
Yes.
So somebody else doesn't pick them up.
In closed bins. That is very important. And more importantly, we are in the worst flu season, as we talked earlier. And if you have not already got your flu shot, get it.
While I have you here, I want to ask you, what we hear medically is that when the weather gets warm, the infection, the virus seems to recede considerably. Is that a high expectation of those of you in the medical field?
So the honest answer for this particular virus, we don't know. So most respiratory viruses tend to recede towards summer as summer kicks in. But with this particular virus, we're still learning about it.
We can only hope that if the weather gets warm, it recedes. Yeah. All right, you started on the travel thing. All of us, and I'm sure many of our viewers, going to travel. Whether it's who knows where they're going to travel, but they're going to travel. You're going to stop at gas stations. You're going to stop and eat. You're going to interact with people.
So
what's the latest?
There are no specific travel advisories for travel within the United States. And so I think that people right now can feel comfortable if they're driving to another city or if they're flying. Again, wash your hands, use hand sanitizer, don't touch your face, so those type of precautions. But there are some international travel advisories. They're available on our website as well as on the CDC website. And specifically, they're recommending no travel to China and Iran. And then significant caution about traveling to Italy and South Korea, and also some caution about travel to Japan. And so it's really important for people who have travel plans to keep checking the websites, because every week those advisories are adjusted.
All right, should we search out a physician if we think we're sick, if we have some, and the symptoms could mirror the symptoms of many other diseases, right? So if we suspect, what should we do?
So like any other respiratory illness, if you're having symptoms of a respiratory infection, which is fever, cough, shortness of breath, body pains, fatigue, you should seek your physician's advice. And I would also add a word of caution that you want to make them alert that you're coming in, and you want to discuss if you're suspecting that you may have COVID-19. You want to give them a heads up so that they can prepare to receive you at their facilities.
All right. Well, look, I want to thank both of you for coming in. This is a truly important topic, and hopefully it will, the spread of the disease will diminish, and hopefully it will go away sometime soon. Probably not, but that's a hope. All right. Coming up, we have the president of the Pennsylvania Healthcare Association. We're going to talk about what is going on in nursing homes to deal with the potential spread of this virus, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, we're going to continue to talk about the coronavirus, and joining me to talk about it is Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. They have something to do with the nursing homes in the state, just a little bit. We have them on frequently to talk about it. And I'll tell you, Zach, here's what we know, and you'll help me out. Older people more likely to get the virus than younger people. Older people, especially if they have some underlying medical condition, which adds to the possibility of infection.
And doesn't that sound a lot like a resident in a nursing home, personal care home?
You're absolutely right. So what are you doing? Obviously, you're monitoring it, but go through some of the steps that you're taking to ensure if there is an outbreak that it's limited, hopefully curtailed.
Sure, and thank you for having me, Terry. It's interesting because the first confirmed case in the United States of coronavirus was actually in Washington State in a nursing home.
Wow.
And in the days following that, we've seen staff who have been affected and other residents who have been infected with the virus. So obviously it hits close to home here in Pennsylvania. And long-term care is really at the epicenter of preventing or trying to control this virus. So even though, and we heard the Secretary say it very clearly, even though there have been no reported or confirmed cases in Pennsylvania, I can tell you that long-term care providers are taking every precaution and every preventative measure to ensure that whether it's an outbreak or whether there's one reported case in a facility, they're ready to combat this thing.
Yeah, well, let's go. I mean, obviously, when you're dealing with the staff of nursing homes, there's, I think you've referred to as re-education that has to go on. Explain that.
So it's not that different, believe it or not, from a flu outbreak. And we're in the midst of the flu season, and you heard the physician who was on before talk about that. You know, the things that long-term care providers need to do, and we're trying to get this message out to our membership across the state, is clean commonly touched surfaces, educate or re-educate staff on the use of PPE, and that's personal protective equipment. So your goggles, your gloves, your masks. And you want to make sure that if you have a loved one in a long-term care facility and you're feeling sick, or you're a staff member of a long-term care facility and you're ill, that you don't go in to see your loved one or to care for those residents.
You know, you're into an important subject because, you know, my mother was in a nursing home and we visited frequently, and you get people, you know, obviously they want to see their loved ones. They want to, and that's one way, an important way in which the disease can spread.
So we'd encourage folks to use Skype, to call, to try to take, you know, every opportunity to use that technology, because we want to make sure that no illnesses are brought into the facility where you have a very vulnerable population.
Well, let's think about this. Obviously, if these people are in a facility and they're not leaving, it's not likely that they'll get it, you know, because of something that occurs inherently inside the facility. The fact is that it's likely to be brought in by someone who works in a nursing home or visits to patients.
Potentially. That's certainly a potential cause for this. You know, it's worth noting that in Washington State that they have looked at some of the things that they needed to be prepared for, and that Pennsylvania will need to be prepared for. And that's making sure we have sufficient staff, sufficient supplies, so that we can try to control any sort of outbreak of this virus.
All right, we're going to run to a break. We may pick up a couple of other points, but I also want to talk about the long-term care budget proposal with Governor Wolf. He's smiling. We'll see if there is a budget proposal for long-term health care. We'll get to that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society, inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine, and by the Pennsylvania Healthcare Association, the future of long-term care.
All right, I'm chatting with Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. We're talking about nursing homes and the steps that they're taking to deal with the potential of the spread of the coronavirus into nursing homes. And by the way, I'm sitting here doing this, and Zach was doing this. How hard is it to keep your hands off of your face? It's almost impossible to do it. We need a whole new learned experience, and I'm saying that in a very serious way. Even though I'm smiling. All right, $8 billion just appropriated, you know, by Congress to fight the infectious diseases. Is there anything? Have you made any specific requests to the governor of the Commonwealth and to the state legislature yet? Or let me put it this way: if you haven't, do you anticipate asking the legislature for monies to prevent the spread in nursing homes?
Well, that's a great question, and we appreciate the support from the House of Representatives at the federal level for help with the coronavirus, and I know the Senate needs to ratify
but it looks like they're going to do it.
And they should.
Yeah,
you know,
absolutely.
I think we do need to be prepared, and before the break, we talked about in Washington State what they needed. When staff got sick, Washington State needed more nurses, and they needed more funding to bring in nurses from other states. They needed funding for more supplies from other states. And I would think that if this hits Pennsylvania, if coronavirus comes to Pennsylvania, that we're going to be making a very similar ask to our governor, to our Department of Health, and the Department of Human Services.
Yeah, I would think that money, I mean, obviously there has to be specific needs, and you have to demonstrate that to the legislature. And I would think just not nursing homes, but other areas of healthcare in particular would be, asking for assistance, and it should be a major priority for the state until this disease is, reduced considerably, hopefully eliminated at some point with a vaccine.
Right, and again, we have the luxury here in Pennsylvania that Washington State didn't, that we can be prepared. And we know what we need, and we can use other states as examples to learn exactly what we need to do to make sure we're ready.
So there's a learning experience out of how much you should ask, but maybe more importantly, it's what you would use the money for, and demonstrate to the legislature that the money that you would request would be used in a way that would help combat the spread of the disease.
Correct.
Right?
And again, that's more staff. That's more frontline direct care workers. Those are more supplies. All of this potentially coming from out of state, more testing. Don't forget about ancillary services like mobile x-rays and therapists. If someone is infected with coronavirus, what does it mean for those groups? Because these are all essential services that long-term care providers provide to their residents every day. We need to make sure that we're able to continue that care even in the face of this.
You just raised a great question. I think we tend not to think, if you get several people in a facility with it, that you need not just equipment, but you need staff, you need people who are competent to deal with the problem, and we talked earlier about educating the staff in terms of how to deal with that, plus protective equipment. I mean, all of that could suddenly mushroom, correct?
That's exactly right. And I do want to say Secretary Levine was on the program before me. She has been a fantastic leader throughout the state of Pennsylvania in the face of coronavirus over the past couple of days. I mean, we've relied on her and her department and her staff, and I have all the confidence in the world that they're going to be able to handle this and be ready for it.
I'll tell you what it seems to me particularly important here, and that is that we have no confirmed cases in this state, but there are confirmed cases in several states, and plus there's a learning experience going on that that the healthcare folks in the state, and obviously what you do, there's a learning experience from what works and what doesn't work in other states, and that seems to me also to be critically important. So if you if you need additional monies, to know exactly what you want, what you need, and then to be able to use it properly.
Yeah, and again, I want to make sure we say that this is not that different from a flu outbreak or from flu season in general.
In terms of how you would deal with it.
Correct. And most long-term, if not all long-term care providers, have infection prevention protocols in place already. And it's just a matter of making sure that those processes work.
Yeah, and you're comfortable with that.
I am.
That even with the spread, that there's enough procedural considerations in place to deal with it.
We'll be ready.
All right. Well, look, I think this is an important subject. If there's a break, I want you to give us a call if something changes, and you'll come in the program and we'll work you out into the agenda. All right. We'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.